Hi everyone, my name is Abida Mohammed and I am a master's student at San Jose State University, specializing in stem cell research. The topic that I want to talk to you guys about is about stem cells and their potential for medical therapeutics. So what is a stem cell? Stem cells are special human cells that have the ability to develop into many different cell types, from muscle cells to brain cells. In some cases, they also have the ability to repair damaged tissues. Researchers believe that stem cells-based therapies may one day be used to treat devastating diseases like paralysis and Alzheimer's disease. Stem cells are usually divided into two main forms, embryonic stem cells and adult stem cells. The embryonic stem cells used in research today come from unused embryos, which are usually an in vitro fertilization, or in other words, they're fertilization that happens in a lab dish. And these unused embryos are donated for science and research. These embryonic stem cells are called pluripotent because these cells have the potential to become any type of cell in the human body. So how do stem cells help us? So CIRM is California Stem Cell Agency, and it stands for California Institute for Regenerative Medicine. And CIRM's mission is to accelerate stem cell therapies to patients with unmet medical needs. So right now I want to illustrate two remarkable stories of two individuals who were diagnosed with life-threatening diseases, and through CIRM and through stem cell research and therapy, they were able to overcome their diseases and are fully cured. So the first story I would like to talk about was Evangelina. And Evangelina was diagnosed shortly after birth with severe combined immunodeficiency, or SCID. It's also known as a bubble baby disease because in the past, children were kept in sterile plastic bubbles to protect them from getting sick. It's a very rare and often deadly genetic disorder, which meant that she had no functioning immune system, and which left her vulnerable to infections. Many children with this condition usually die within the first year of life. Evangelina was cured as part of a clinical trial at UCLA run by Dr. Dawn Kahn. She underwent a stem cell transplant that took her own blood stem cells and genetically re-engineered them and returned them back to her body. These re-engineered stem cells created a new blood and immune system for her. Now Evangelina can play outside and with her siblings and friends and lead a normal life. The second story I would like to talk about is about Carl. In 2006, Carl was diagnosed with throat cancer. He had the tumor and his vocal cords removed and now relies on a voice box to speak. Several years later, doctors found that the cancer had come back and this time had spread to his lungs. And this is how Carl became the first patient in the CIRM-funded clinical trials at Stanford. The trial itself was used as a monoclonal antibody to target a specific protein, which was called CD47. And this sits on the surface of cancer cells. Basically, the protein tricks the immune system into not attacking the cancer, hence spreading the cancer cells. The monoclonal antibody, which can disable the CD47, left the cancer vulnerable to being attacked by the patient's own immune system. The therapy had stopped Carl's cancer from growing, which has allowed him to spend more time with his family and friends. So, what can you do to help? Well, the first thing that you guys could do is, if you're eligible to vote or know people who are eligible to vote in California, please vote in favor for California Stem Cell Research and Treatment and Cures Initiative of 2020. Basically, this proposition will allow $5.5 billion to CIRM to continue stem cell research. And for those that are interested to learn more about stem cells or want a hands-on experience, there is the Skill and CIRM Bridges program, which is a master's program if you're interested into continuing research in stem cells or want to be part of the Skill CIRM Bridges program. Another program that is also helps you learn more about stem cells is SPARK, which stands for Summer Program to Accelerate Regenerative Medicine Knowledge. It's a 6-week summer internship program for high schoolers, and it's a great way to get to know more about what stem cells are, what research is being done, and basically get more knowledge on what stem cells are, and you can spread it around to your friends and family for the potential of stem cells in the future of medical therapeutics. Lastly, I want to thank you for listening to this presentation, and I have a few links up on the slide if you guys want to have more, go in and see more information about stem cells, CIRM, and even the programs that I mentioned before. Thank you again.